Hi everyone, welcome. Hi everyone, welcome to our virtual town hall. We're going to give folks just a couple minutes to join us before we get started. Thank you so much for your patience.
Edit mày ra. Đừng có nói edit mày kỳ lắm. Bích Trang, sao không có vậy?
Great, thank you all so much for your patience. And we really want to thank you again for joining today's discussion to answer your questions about the COVID-19 vaccine. My name is Nguyen Deng. I'm the Executive Director of CRAC, the Southeast Asia Resource Action Center, and I'm so excited to be here today for this important conversation. Today's live discussion is actually the first time that we've ever hosted a virtual town hall with Vietnamese translation at the same time. So thank you all so much for being the first time guinea pigs for us as we try this new program. And we're so excited because we want to make sure that we're able to hear from you today. And to do that, I'll go over just some quick instructions. First, for those who are joining us through Zoom, we have two Vietnamese interpreters who will provide simultaneous interpretation for the event. For this option, all you have to do is go to the interpretation icon on the bottom right of your screen and select Vietnamese. While we're not able to stream the Vietnamese interpretation on Facebook Live, we'll make sure to share the recording in Vietnamese on Facebook tomorrow on CRAC's Facebook page. I want to thank our interpreters for this event, Chị Trân and Chị Phương, for making it possible for us to host our Vietnamese-speaking community members. Thank you both so much. And secondly, this session is also being recorded so that you can share a website link to the recording for your friends and family if they weren't able to make it today. You can share this event on Facebook through www.facebook.com/APIAHF, and we'll also send that information in the Zoom chat box in case you're joining us by Zoom. And finally, we really want to hear from you. So please feel free to ask questions or make comments throughout using the chat function on Zoom. We'll also be gathering comments and questions on CRAC's Facebook Live page. And at the end of the event, we'll be sharing different resources to stay informed. And we're here today because we're over a year into the COVID pandemic, and many of you know friends or family who've gotten sick, many who've recovered, and others who've passed away. We know that the pandemic has also separated our families and have made it very difficult for some of us to actually keep our jobs, to pay rent, to make sure that there's food on the table. So we know that getting vaccinated is really important to all of our families, and it's really important to save lives. But we also know that many of our friends and our family members are afraid and don't trust that the vaccine is going to be safe for them without enough information or incorrect information about its safety. So that's why we're here today, because we want to change that. CRAC, along with our partner organizations, who you can see on the next slide, are here because we want to make sure that our communities understand that the vaccine is safe, that it can save lives, by answering the top questions that we've been hearing from our community members so that we don't have to be afraid. And to answer these important questions, we're joined here today by two expert doctors from our community, Bác sĩ Tùng Nguyễn and Bác sĩ Anh Thu Bui. In case you don't know them, Bác sĩ Tùng received his MD from Stanford University School of Medicine and is the Stephen J. McPhee MD Endowed Chair in General Internal Medicine and the professor of medicine at the University of California, San Francisco, where he provides primary care to a diverse patient population and teaches students, clinicians, and researchers. He's the director of the Asian American Research Center on Health, and his research focuses on achieving health equity using community-based participatory research, patient-centered outcomes research, and other stakeholder-engaged methods. Dr. Nguyen was commissioner on President Barack Obama's Advisory Commission on Asian Americans and Pacific Islanders from 2011 to 2014, and chaired the commission from 2014 to 2017. He founded and is currently president of Covet, the Progressive Vietnamese American Organization, a nonprofit advocacy organization. Welcome, Bác sĩ Tông. And we're also joined today by Bác sĩ Anh Thu Boi, who came to the US in 1978 at age 11 as a refugee. She earned her medical degree from the Mayo Clinic School of Medicine and has worked as a community psychiatrist for more than 20 years. Much of her work in advocating for individuals with serious mental illness has been informed by witnessing trauma in her family and community. She holds board certifications in psychiatry, community, and public psychiatry and addiction medicine. Since 2015, she has served as Associate Medical Director of Psychiatry for Lifelong Medical Care, a federally qualified health center with several primary care clinics in East Bay. She has been appointed by the county board supervisors to serve on the Mental Health Advisory Board for Alameda County, California. She also joins us from the Pivot team and is a founding member and board member. Welcome, Bác sĩ Anh Thu. Thank you both so much for being here. And I'm very thankful to our interpreters because I would not have been able to translate most of the fancy titles and background that you all have, but so honored to have you both as leaders and role models within our community. So are you both ready to get started? And we'll go ahead and jump into our questions. So we're going to try to answer the most frequently asked questions that our communities have been asking us about the vaccine. So the first one will go to Bác sĩ Tông. When my dad got vaccinated, the next day he asked me, what exactly does it do? So would you be able to share with us what the vaccine actually does?
Sure. Thank you, Gwen, and thank you, Sirac, for inviting me to come and talk and discuss some of these issues with our community. So actually, I've been thinking a lot about how to tell people how does the vaccine work. And it turns out that actually the best way to describe how the vaccine works is kind of like a natural medicine. Like, you know, how Vietnamese people and Asian people are really into, letting their body take care of things. And that's all a vaccine really is. A vaccine basically presents a part of the virus, part of the thing that's causing the problem to the body and allows the body to learn how to fight it. That's it. It's probably not a whole lot different than us taking some herbs or something, from my perspective, because that's how safe the vaccines are. And then it allows us to build up our defense system or immune system so that when the virus actually comes, our body's ready for it and can get rid of it.
Great. That sounds pretty harmless. But I think a lot of the questions we get is the thing that you're putting into your body, is it the live virus itself?
Yeah, so no, absolutely not. You do hear some things about like how the actual piece of the virus is coming into the body delivered by other things, but the actual COVID-19 virus itself is not being put into your body. The COVID virus 19 carries certain signals on it, and basically the vaccine just take a piece of one of those signals and gives it to your body so that your body recognizes to attack it when it comes. So absolutely, you cannot get the COVID-19 virus from the vaccine.
Great, thank you so much. Another question that we often get about the vaccine is that it sounds like you can still get sick even if you get vaccinated, but you get less sick. Is that right?
Well, we're talking about things like probability here. So when you say, is it possible to get the COVID infection once you have the vaccine? The answer is yes, it's possible, but it's very unlikely. The vaccines, all three of them that are approved in the United States, are very, very effective in preventing any COVID infection. But the really great news is pretty much even if you did get COVID, in the rare instance where you do get COVID after you've been vaccinated, it really prevents severe COVID infection. Both of these are really important because, of course, you don't want to die from COVID. So you basically have raised your level of protection quite by a lot if you get the vaccines. But also, when you do get COVID, what happens is that you do get sick, and then even after you recover, there might be a lot of long-term complications. So a lot of people think about getting the vaccine so they don't die from the vaccine, but it's also preventing you from getting complications and keeping you healthier in the long run.
Got it. And this next question is something that I've also been trying to Google a lot, which is, can you still transmit COVID after you get the vaccine?
So again, theoretically, it's possible. And the reason why it's possible is that you could inhale the virus into your nose and it sits there. And what happens when you have the vaccine, it helps your body's defense. So it prevents the virus from going any further than that. So it doesn't get into your lungs or the rest of your body, or it can cause other difficulties. So theoretically, the virus can sit in your nose and then actually you can sneeze it and it gets to somebody else. So it's theoretical, though. I'm not sure that there's been shown a case of someone who got the vaccine who transmitted the virus to someone else. But that's really raises the importance of, even after you get vaccinated, in order to protect others around you, including your family and your loved ones and your friends and everyone else you come in contact with, you should continue to wear your mask and continue to stay 6 feet apart until we know more about what happens.
Great, perfect. So to summarize so far, the vaccine just helps to teach your body how to fight off the virus. It does not include the virus itself. You might get sick, but the chances of you getting very, very sick to the extent that it may lead to death is much, much lower. And you have to remember to still wash your hands and wear your face mask because the vaccine is just one very important part of how to keep us safe.
Yeah, I do want to emphasize the low likelihood of getting COVID once you get the vaccine, because when we talk about something that's common like the flu shot, and a lot of us believe in getting the flu shot, right? A good flu shot in a good year is about 50 to 60% effective at preventing the flu. All 3 of the COVID vaccines we have are way above that. 2 of them are in the 95% or more, and the other one is in the 75 to 80% range. So I have to say, again, we have to be careful. We don't want to catch the infection. We want to be careful, but it is really, really effective.
Great, thank you so much. As we're talking about the 3 vaccines that Vaccinated just talked about, this next question is for Vaccinated. Can you tell us a little bit more about what are the differences between those 3 vaccines that have been approved between Pfizer, Moderna, and Johnson & Johnson?
I'll do my best. Xin kính chào quý vị. Thanks for having me here. I have to really clarify, though, that I am not an expert in this area. I am a psychiatrist, and in medicine, we really say expertise is with people who do this day in and day out. Having said that, as a psychiatrist who's always interested in patient education, I do a lot of reading of educational materials, and I try to think about ways to explain it. Like, I feel like if I can understand it, then maybe, lay people can also understand it. But the expertise will be with my internal medicine and infectious diseases colleagues there. So I do a lot of Googling just like you, and reading all of the public websites. There's lots of great ones out there. So if I think about the differences, I think first about what's similar, though. I think about them as they are all equally, well, I can't say equally because they haven't been studied head to head, but they have all shown to be highly effective at reducing COVID transmission, reducing severity of the COVID infection, illness, and reducing rates of hospitalizations and rates of death from COVID-19. And then the differences really are in terms of timing and logistics. So the Moderna and Pfizer have to be delivered in 2 separate injections to be effective. And so then they're like, Moderna has to be delivered within the second dose is 4 weeks after the first dose. For Pfizer, it's 3 weeks after the first dose. And then Johnson & Johnson is just 1 single injection and that's it. And then some other logistical things that we have to consider in terms of availability, where the vaccine can be delivered to different communities has to do with refrigeration. Pfizer and Moderna both have to be in deep freeze. Pfizer lasts, I think, only a week after it's been thawed out. And I think Moderna can last for like 30 days after it's been thawed out. So in terms of different clinics, how far away they are from the original sites, that has to do with like, storage. I think Johnson & Johnson is only normal refrigeration. And I think one thing that people are interested in knowing about is how Dr. Tung talks about how the vaccine gives your body the instruction on how to fight off the COVID infection. So one thing people are interested in knowing is like exactly how do they do that? So Pfizer and Moderna use the mRNA, which is a blueprint essentially. It's a set of instruction that is delivered into the cell so that the cell can make that spike protein that the body can recognize on this coronavirus and start to make an immune response that's directed toward that spike protein. And then the Johnson & Johnson delivers the blueprint in a different fashion than the other 2. But other than that, it really just tells the body the instructions on how to do it. And there is no COVID virus that's contained in these instructions. And actually, the instructions get destroyed by the body cell once it's in there and the body has already done its job. And that's it. And yeah, thank you.
Got it. I think I understand that explanation very clearly. I think that the next question is can you choose which vaccine to get? Especially since this is what we're hearing, because a lot of people want the one that has like the higher rates of prevention. So I think that's the first question is, can you choose which vaccine to get?
The availability of the vaccine might be limited depending on where you are and who gets what. So it might be difficult to have that choice. So I think it's going to be, our recommendation is really get the one that's available to you first. In terms of the number of effectiveness, I would advise people not to worry because again, even though the Johnson & Johnson vaccine has a lower effectiveness rate, it was studied under different circumstances. The Moderna and Pfizer were studied first, and then the Johnson & Johnson was studied now that we've had COVID variants and a lot later. They all have been studied in a diverse population, and they were not compared head to head. So really the effectiveness are not equivalent. You can't equate the numbers. So the best vaccine is the one that's available to you the soonest. And that's what we recommend that you do.
Awesome. The best vaccine is the one that's available to you the soonest. We should create a tweet about that. The next question that usually follows is if someone gets one vaccine for the first dose, can their second dose be from another company? And I'll have either Vaccinated or Vaccinated if you can answer that question.
Yeah, I would say no. So obviously the Johnson & Johnson is a single shot. So once you get that, you're done. You don't want to mix the Pfizer and the Moderna vaccine for the simple reason that the studies and the efficacy rates and the safety data that we have is for people who got 2 of the doses from the same company. So it doesn't mean it's terrible, but it doesn't mean that we can rely on anything that if you mix the 2. So.
Got it. So Moderna and Pfizer are the ones that require 2 doses, and you have to take your second dose with whatever company you took the first dose with. And
Yeah.
Johnson & Johnson is just 1 dose.
Yeah, and I do want to be clear that even though in the studies they are one of them is 4 weeks apart and one of them is 3 weeks apart, there is some flexibility in scheduling that. In general, wherever you're getting the vaccine, they should be scheduling you for the second dose when you're done with the first dose. It may not be exactly 3 weeks or 4 weeks, but that's okay. That's not that important. So.
Okay, perfect. And this next question is actually one that we're also seeing from the chat box, which is, how do you know that the vaccines are actually safe, especially for community members who aren't really quite sure, don't really want to know what an mRNA is, and maybe don't quite trust what they're seeing? How can we share with them about the vaccine's safety?
Yeah, I think I can take that first. I would say that number one, every single pill that you take in this country, in the United States, has been approved by the Food and Drug Administration, has undergone a very rigorous testing process before it's even allowed to be sold. Okay, and that rigorous testing process applied to all 3 of the vaccines that we got now. There was no corners cut in that process at all. The reason why it went so fast was that, number one, the scientists came up with the vaccines quickly. Number two, they were able to get 30 to 40 to 50,000 people to participate really quickly. And then they analyzed the data and they evaluated the data quickly, because it was so urgent. You could design another drug that will take 2 or 3 years for approval because it's not urgent. And so they'll take their sweet old time, and, they have a meeting and they have a meeting a week, 3 months later. This is not the case with the COVID vaccine, and it shouldn't be. So, but what I'm saying is that just because the time went quickly, it didn't mean that any steps were skipped, right? So that's number one. Number two, during the studies, which have 30 to 60,000 participants, we saw very few serious side effects, very few. When the first 2 vaccines, the Pfizer and the Moderna, came out in December, we were all very concerned, like, how safe is this? Even though the data looked good, right? The data looked really good. As a matter of fact, I will tell you now, 3 months later, after millions and millions of Americans have gotten this, I'm even happier with the safety profile than I was when it came out in December. After 14 million doses were given, the CDC, the Center for Disease Control, looked at the data. They couldn't find a single death that was attributable to the COVID vaccine. Okay. So if someone gets the vaccine and then they die, it doesn't mean they die from the vaccine. They may have died because they're older people, they may have gotten something else. So you can't associate that. But as far as the data that we see, no one has, at least in that 14 million doses that they looked at, no one was thought to have died from the COVID vaccine. A lot of the serious side effects that we thought we would see, we were not seeing on the same frequency. Okay. Admittedly, though, people don't feel good when they get the vaccines. A lot of them don't. Mostly pain locally in the shoulder, some aches and pains, and some fatigue. I actually had mine, and the day after my second dose, I had to take a nap for like 3 hours because I was feeling tired and having a little bit of chills. But then I woke up, had dinner, and I was done. And a lot seems like a story for a lot of people. So not to say that you won't feel bad with the vaccine, but it's not that bad. And compared to the COVID infection themselves, nothing is even close.
Right. So it sounds like that the vaccines are really safe because, one, the government has gone through every single step that it needs to really make sure that it's safe. And our government does that for every single medication that we are able to take here in the US. And also that people are doing even better than what the research originally showed. And to your question or to your comment about the side effects, that was definitely one of our questions too. What are the side effects that you can expect? And how do they compare to the flu, for example? Are they relatively normal?
I would say maybe a little bit heavier than the flu and more common than the flu shots, but similar in the sense of what you can expect.
Great. Yeah, my arms usually get some type of numbness with vaccines, so I need to make sure to like exercise and all that. So going back to some more of the questions about the vaccine and how you can get them. The next question is for vaccine. Do you need to have health insurance to get these vaccines?
The vaccines are free, even if you don't have health insurance. It's provided, it's purchased by the government and paid for. I think there's a caveat that some places may be able to charge an administrative fee for delivering the vaccine, administering the vaccine, which can be reimbursed by public or private insurance or by a relief fund. But that is a caveat that I actually have not seen in practice. The vaccine has been delivered free as far as I know everywhere.
Okay. Awesome. So it's free, miễn phí. We should definitely go get it, right? And I forgot to ask who, maybe we'll ask Bác sĩ Tùng, who should be receiving the COVID vaccine right now? Is it available for everyone of all ages?
I don't think it's quite available to general population. I think it depends on a lot of it on the supply and the state and county policies. But in general, I know that a lot of us are moving toward pretty much anyone 50 and above should be getting the vaccine now, along with other people who are at high risks, for sure. And I know that it is President Biden's plan to make sure that everyone gets it, I think, in a couple of months. So it's just a matter of time. I think the good news is that we have 3 vaccines that work. So the supplies are pretty plentiful. And it's just a question of how fast can we actually get it out. So I would say that whichever age you are over the age of 16, you should be expecting to get the vaccine probably within the next 2 to 3 months.
Great. And a follow-up question for Bác sĩ Anh Thu is, should pregnant women get vaccinated? I just had my baby 6 months ago. So I remember that was one question that I was looking at pretty often.
I would say that pregnant individuals should seek the advice of their healthcare providers about getting a COVID vaccine. There are some tests on the way to see if it's the safety and effectiveness. Having said that, though, a number of my colleagues who are pregnant have gotten the vaccine, primarily because we know in medicine that pregnancy lowers your immunity and puts you at greater risk for serious illness from flu or COVID infection. I think all of my colleagues who are pregnant have gotten the COVID vaccine and have been doing just fine.
Great, thank you so much. And I think we answered this next question. We actually answered it already. The question is, when can people expect to get vaccinated? And Bác sĩ Tùng, you said in about the next 2 or 3 months is when we should be expecting it to be available to everyone. Is that correct?
Yes, I mean, again, no promises, but I think given the number of vaccines that we have or are coming and how smoothly we've been doing, I mean, I think we've been vaccinating several million people a week, I think, or a month, I forget. It's a lot. We're vaccinating several million people a week, actually. And so it's just a matter of time. Which is really actually an important point to make, because you don't want to get COVID now. Right? You're so close to not getting COVID that this is actually really important to continue to wear your mask and keep social distancing and not sort of do what some of the people are doing, which is, go to big parties and not wear their mask. This is not the time to get COVID. This is bad luck.
Mm-hmm. We're almost there. We're almost at the end. I think that actually concludes our most frequently asked questions. And so I will, I'll ask you both maybe to share your remarks on what is any final thoughts that you might have if there's anyone who's still hesitant to getting vaccinated. And maybe Bác sĩ Anh Thu, we'll start with you.
Yeah, I think it's great to ask questions. I love the engagement. I'm looking forward to looking at the questions from the community. I think you should always make informed decisions. So talk to as many people as you can, talk to your healthcare providers, look at public information websites and ask all the questions that you possibly can. And I think all healthcare decisions should be made that way with, good information that's linguistically and culturally accessible, which is what we're trying to do today with the program. And I would say that among my colleagues, including myself, everyone who have gotten the vaccine in order to continue doing their work as healthcare providers have felt really great and a great relief because our options for interacting with others have increased. It's great relief to see the number of hospital rates going down in our community. So please go get your vaccine when it's your turn.
Great, thank you. And Mexico, what would you say to folks who might be still hesitant or a little scared?
Yeah, I mean, I'm totally with Dr. Bui on this because certainly everyone has the right to make their own choice about what they put into their body. But I think as a physician, I want to make sure that when my patients are making that decision, that they have adequate, good information to make those decisions, right? So we'll talk a little bit about where Vietnamese people can go to get more good information about this. But given the information that I know as a physician, I would absolutely, I mean, I go through this with my patient. I say, okay, here's the risk, here's the benefit, here's that. And then sometimes, a lot of my Vietnamese patients are like, but what do you think? And I was like, you know what, if you're really asking me what I think this is great. I think you should get this thing, okay? So, and I got it as soon as it came out and I was eligible. So what more can I say? I mean, I do want to say though, actually, I was sort of a little bit joking there, but this disease has killed 500,000 people and more in this country, okay? Whatever worries we have on the other side of what the vaccine is or isn't doing, I just don't think the scale balances when you think about 500,000 dead people. If we had this vaccine, at the beginning of the pandemic, 500,000 people would be alive. We would have a life that hasn't been so constrained by all these restrictions. We would not have people losing job. If we could get everyone vaccinated, we may never go back to where we were in January 2020, but we will get a lot closer to a place where we can feel good about ourselves, the health of our own selves and our families and our friends, and are getting out there and doing the work that we normally do. So living the lives that we normally do. So again, everyone should choose and make up their own mind. But this doctor and this Vietnamese American is saying you absolutely should get it.
Great, thank you so much. And so often in our family, that's what it comes down to, is knowing someone that you trust, who you can trust their recommendation for you to feel safe making that decision too. So we've gotten a lot of really good questions from our audience. Some of them are very health techy, and I'm very glad that you both are on here. But our first question is, are vaccine reactions as severe as COVID infection?
I would say no. If you may be one of those unlucky people who get particularly severe reaction, or on the other side, you may be one of those people who are lucky and get a case of COVID that's very mild, you don't even notice, right? So it's kind of hard on an individual level to say that absolutely. But knowing what we know about the complications from COVID, which range from, obviously suffocating to death, bleeding everywhere, getting blood clots everywhere, heart attacks, kidney failures, and dying, obviously. The vaccine's side effects are really, really minimal. Most of the cases, there were a few in the studies where people end up going to the emergency room for some treatments, but most of them, hardly anyone ever had to stay in the hospital because of any of the side effects or complications from the vaccine.
Great, that's helpful. I think I will try to start with clarification questions before we get into some more of the in-depth health questions. So this clarification question is, for someone who's already had COVID-19, how should the vaccine be taken in terms of time after? And I'm assuming that means how long it's been since they contracted COVID.
Yeah, I believe you should talk to your healthcare provider about that specifically, but the recommendation is, I think 90 days after your confirmed COVID infection is maybe time that you could take the vaccine again. I think that's the most generalized answer that I have. Então,
Yeah, no, I don't have any particular information on when you should get it after you get the infection. I don't think there's any harm in getting it sooner, but I think there is some natural immunity after the infection, so you could wait.
Great, thank you.
I think one of the screening questions was definitely like if you've had it within the last 2 weeks, you shouldn't be getting it right now.
Yeah, so that's the number I think about. But
Yeah.
Perfect. And on the theme of folks who might have a particular condition already, how about individuals with allergies or autoimmune compromised systems? How is their experience with COVID-19 vaccines?
So a couple of different questions there. People with allergies in general can get the vaccine and not worry about the allergic reaction. Only a very few reasons why people can't get the vaccine, and all of it has to do with having what we call anaphylaxis, which is a very severe reaction to components that's in the vaccine itself. So in general, the screening question is if you ever had a severe reaction to another vaccine, they may want to take it easy on whether or not you should get the vaccine or how long they watch you afterwards. So that there's no reason. I mean, people talk about I have food allergies, I have nasal allergies. None of that stuff should stop you from getting the vaccine. Autoimmune disease is a little bit more difficult. In general, as Dr. Bui has said, people with immune problems are more likely to get infection and get sicker. So it makes sense for them to get the vaccine. Their body may not react as well to the vaccine in terms of building up their defenses, but even though it may not be as good, it's still better than not having any. So in general, people with autoimmune disease should definitely talk to their doctor, because I don't know the particular in this situation, but it doesn't mean that they can't get the vaccine.
Great. So these next couple questions definitely go beyond our frequently asked questions. And if we can't answer them, we'll definitely make sure that we do a little bit more research and share the responses with our participants today. So one of the questions we received is, what's the problem with AstraZeneca that some European countries stopped using as a vaccine?
All I know is that there's some clotting issues from the immune response, and I think there's been stopping as an overabundance of precaution, just to take a look and see. But that's all I know right now.
Yeah, in terms of the United States, that's probably not a relevant issue, because we're hoping to vaccinate everyone before AstraZeneca gets their approval here. But my general take on it, it's a pretty effective vaccine and still pretty safe. So even though there are some cautionary things that's going on, again, when you weigh it with what happens when you actually get COVID, it's pretty minimal. So again, I don't know that much about the AstraZeneca vaccine, but in places where it is being given, I have confidence that it'll be fine.
Great, thank you. So just to reiterate again that AstraZeneca is not one of the vaccines that are available here in the US because it has not received its approval yet from the FDA. This question is, what's the truth about using fetal cell lining for the Johnson & Johnson vaccine?
So what I know from that is, again, that the adenovirus vector for the Johnson & Johnson vaccine, so it's an adenovirus, which is a common cold virus. It's been modified so that it doesn't replicate inside the cell. But I believe it was cultivated to grow using retinal cells from an aborted fetus. And I think that's the controversy right now. I believe like the state of Michigan is being mandated to tell everybody who's gotten the J&J vaccine about that origin. But that's pretty much all I know right now.
Yeah, I can only say that there aren't any fetal cells in the J&J vaccine, if that's what's important here. I mean, we use fetal cells in development of all kinds of stuff, and I think there are these questions about, whether we should or shouldn't be using it. As a biomedical researcher, we think that if it's going to save lives and it doesn't harm anyone else, we should use it. That's my take on it. But in terms of like, if you want someone's worry about having fetal cells in their vaccine, they shouldn't worry about that because it's not there.
Great, that's helpful. In this question, I don't know if I'm even pronouncing these words correctly, but are the vaccines aluminum adjuvated? There's no cause-effect relationship between aluminum and Alzheimer's found yet, but there's an ongoing.
There's a lot of misinformation out there about the vaccine. There is no aluminum component in that vaccine. So, the question about Alzheimer's and aluminum is a different question that has, we don't want to get into, but there is no aluminum. There is no thimerosal. There is no fetal cells. And there's a lot of stuff out there that people are saying. And so we do want people to make sure that know the fact, right? I mean, again, make the decision based on the facts and what's important to you, not on what rumors are and what's flying around, because there are people out there who have ulterior motives for telling people not to get the vaccines. And so we have to be very careful about that.
Great, that's really helpful. Let's see. We definitely have a little bit more time for questions from the audience in case folks want to submit any more. One question I had was, we're hearing about like fourth strains of COVID entering the country now. And I'm curious how you would respond to people who wonder if this vaccine is going to protect against these new strains.
So I can take a first crack at that. The available evidence shows that they do protect against many of the new strains. What's important is that they do protect against severe cases. That's really important to know. But there is no way for us to say that it's going to cover all new strains to the same degree that it covered the strains that it saw during the studies that were done in December or late last year. So, and that's the reason why we do say to people, until we know better, even after you're vaccinated, you still have to protect yourself. You still have to wear your mask. You still have to maintain social distancing, just to be cautious. The other thing that's really important is that one thing that people really underestimate what happens in a pandemic is the more people are infected, the more mutations of the virus occurs and new strains occur. Right. So when the pandemic was like, hundreds of thousands of people every day, the chances are new strains are going to come up. That's just the way things work. And so the more that we protect ourselves and fewer cases we have, actually, the less the chance of new variants of the viruses coming. So that's really an underrated point about that.
Great, thank you. And one other question I have is, what happens if you don't get the vaccine, if you choose not to?
You mean to yourself or to your community?
Both.
I think it's always an individual choice. I think choosing not to get the vaccine would always put you at greater risk of both contracting the virus and of severe complications, including death from the virus. And then as far as the effect of it, we really want to reach herd immunity in terms of at least getting a large percentage of the population. I believe for COVID, we're hoping to get up to 80% or so, even maybe more. I think this is so new that we don't exactly know, but that's the whole point, is that if the more of us are protected and immune against the virus, then there's fewer places for the virus to go, and the more we can get back to normal, the way that we would really want to be living our lives again.
Yeah, I agree. I mean, certainly, again, if 95% of the people get vaccinated and 5% of the people who don't decide not to get vaccinated, that 5% is still at risk, right? they are safe, they're safer because no one else is going to give it to them. But they still can pass things around. This is why we see cases of measles and things like that in a highly vaccinated population. And COVID is not like the measles. COVID can kill you pretty quick. So taking that chance feels, for me, I'm a very cautious person. That feels like a big chance for not a particularly good reason. There are moral and ethical reasons not to be what we call a free rider. A free rider is someone who benefits without taking on any of the risks. And of course, that's kind of a natural human things to want to do. But when you live in a community, you kind of want to be very careful about that because, no one likes free riders.
Great. So it sounds like if you don't get vaccinated, you are harming yourself, but also the larger community around you. That means your family who lives with you. It means your grandkids who might be living with you, or the older adult who you might be caring for. So it's not just about you, but it really is about your family and the larger community as well. And I will say, I'll do one last call for questions. If you're interested in asking a question verbally, feel free to click on the raise hand icon on your toolbar and we'll unmute you. And in the meantime, feel free to also send any questions through the chat box. I don't see any so far. So I'll ask Maxitong if there's any questions that you think I should have asked that we haven't asked so far.
Yeah, well, one of the biggest questions is when and how will we vaccinate young people like under 16? And I know that there are some studies going on now with some of the vaccine in younger folks. So hopefully, if we need what we call evidence-based data to vaccinate those who are younger, we should see that soon. I really think that's an important issue for getting people back to school safely and things like that. So I know that's in people's mind.
Great, thank you so much. Maxi, do any last questions? I know that we also have one last participant question.
Yeah, and I think that was an important question because that's one that is much on my mind as well. What can you do after you're vaccinated, both to protect yourself, but also what are the range of activities that you can do safely? And I would advise following the CDC Center for Disease Control guidelines right now. And I'm actually still reading it for myself and trying to decide what to do. Some of my colleagues said that once you're vaccinated, you can hang out with a certain number of people who have been vaccinated. The CDC says you could do it indoors, but I am not doing that right now. I am still meeting people outdoors and still with mask on and definitely not eating and drinking around them. Because again, I think even though, let's say taking it at the highest effectiveness rate is 95% effective, that still gives you a 5% chance of getting COVID, right? And possibly also transmitting it unknowingly. So right now, even though I've been vaccinated since date, actually it's been more than a month, I'm still taking ample precautions so that I don't unknowingly transmit the virus. So I'm still social distancing and wearing masks. But the CDC has provided some guidelines about being able to see your family members who've been vaccinated, maybe giving hugs to your grandparents who've not been hugged for a year, things like that. So I think it's an important question to continue to follow and see what's safe.
Great, thank you so
Yeah,
much.
I actually think that's a very important point. What we're seeing with older people is the social isolation from the virus and the pandemic has been pretty tough on them, both mentally, physically, emotional, cognitively. And so one key reason to get vaccinated is if they're vaccinated and you're vaccinated, you can feel a little bit better about going to visit them and touching them and things like that. So
Great, thanks so much. I think we have a question from Joe Long. Joe, your line's unmuted in case you'd like to share your question.
Thank you very much. This is Joe Long. I would like to say thank you to the two doctors. I was going to mention the problem we have in Southern California with the elderly, especially the ones living in Orange County in the mobile home park. they don't have transportations, they don't have phone, they don't have computers, and some of their relatives try to make reservation online, but having problem with logging in. It's always busy. It's always no appointment available. The way I did it with my relatives, I just keep hitting refresh, uh, so many times, or we have to call and wait for an hour. And that's a problem with Southern California. We have a lot of elderly disabled. So the two things make it very difficult for our elders. Another problem I see in Southern California, we have a lot of Vietnamese operated restaurants, nail salon, hair salons. And I'm sorry, but those food category is considered essential, but people working in the nail salon and the hair salon are still not eligible for the vaccination. We have to get everybody in our community to vaccinate. And I'm trying to get everybody in my community, in my neighborhood, everybody I know to get vaccinated. Thank you.
Thank you so much, Joe. Anh, you want to respond to that?
Yeah, I think that's just an important point. We talk a lot about how to convince people who don't want to get vaccinated to get vaccinated, but I think the other problem is much bigger, which is all these people who want to get vaccinated who can't get vaccinated. In research, what we call this is the delivery problem versus the discovery problem. We discover a vaccine in 12 months, but delivering healthcare, delivering vaccines is more complicated. All I can say is that since Joe Biden took over, I think the machineries have revved up quite a bit. And you can look at the number of vaccines delivered daily and see how it's gone up by a lot. So the good news is it will get better. The bad news is I think some of the logistical problems that are being mentioned are just generally a problem with our community getting access to care for various different reasons. And the way to address that, I think, is a very complicated conversation that we need to have, particularly with each individual local community. So, so I don't have an easy answer to that.
Right. Thank you, Anh, and thank you, Joe, for that question. We met with President Biden's Equity COVID-19 task force last week, and that was one of the issues that was raised, is that elders don't have transportation. And so we need to make sure that there are plenty and more investment in our community to make sure that those type of solutions are also being addressed. And I'll ask one final question, and then we'll go to resources to wrap us up. The final question is, should we call COVID a common flu or make sure they're different? And this is an interesting question to me because I remember my dad said, it's just like the flu. It's no big problem. It's kind of the same. So curious how you both would address that question.
I don't think of it as the flu because it's much more infectious and kills people at a greater rate than the flu. Although I suppose there's been a lot of parallel, maybe epidemiologically and historically, to the 1918 flu. So maybe it's a way to think about it. It is a virus, so I suppose that's a commonality. But I suppose that's a good question. I think of it as a way different than the flu. It's so much more infectious and so much more deadly.
Yeah, no, I agree. I mean, of course, like Dr. Bui said, they're viruses. They're mostly transmitted through breathing or respiratory mechanisms. So there are some similarity, but this is a much different type of virus. It's not even the same group of virus, and it is much more severe and much more infectious. And so certainly none of us ever remember a flu season where basically the whole country has been shut down for a year. So hopefully that's no longer something that people need to be confused about.
Great, thank you both so much. And before we close our town hall, we want to make sure that we were able to share some resources with the community. And like Bexy and Bexy Tong said, this is about constant conversation with our communities. So the first resource I want to share were some images that we were able to create on CRAC's or from CRAC to answer some of the most frequently asked questions that we've received, including many of the questions that we asked here today. We worked with ICANN and the SEED project to create these infographics, and we'll also be releasing them in 4 different Southeast Asian languages in Hmong, Khmer, Lao, and Mien. And folks can feel free to visit our website, crec.org-COVID-19 for more information there. And we know that Maxi Anghu and Maxi Tong also have some resources to share from Pivot. So I'll go ahead and let you both share out on those.
Okay, great. So first, I'd like to talk about the bilingual site that provides information on COVID. It's called vietcovid.org. And if you click on the website, there is a lot of information that you can see. There's some basic information about the vaccine, about COVID-19. You keep scrolling down. We have there's some steps, general steps overall on how to locate the vaccine, including looking for your state, calling, making appointments. And then one of the things that we have done is we've been crowdsourcing this information for 20 different communities that have a high number of Vietnamese Americans. And if you all want to help out, feel free to email us and definitely help out, because all this information is constantly getting updated by volunteers on the ground. So if you click on a certain part of the map that you saw earlier for the national map, maybe we can go with Joe Long, since you spoke about Southern California. So if you click on California state, and this is how you can locate vaccine that is available in your area. So if you scroll down just a tad, you can get some, and this is available in Vietnamese too. So if you can click the Tiếng Việt part, you can see it all in Vietnamese. So there's the criteria that's current in California. There's the numbers of infection and number of vaccinations available. And then you can enter in a zip code. Joe, what's the zip code that you might want to enter for your area to look for where the vaccine might be available?
I think Joe got muted by our hosts.
Oh, sorry. Okay. Maybe somebody can just throw out a zip code. All right, sorry, you have to actually enter the zip code twice. And then it lists out all the different places that might have the vaccine. Now, as Joe may mention though, the stock might run out quickly. So you might have to call and sometimes the phone line is busy, so you have to call again. But this is one way that we can at least try to figure out a way you can get the vaccine. The other thing that I would like to emphasize is maybe you can access your community health centers, which actually has, like mine, does send out people to home visits, and also street medicine team to vaccinate folks who are unhoused. So anyway, this is one tool that we're developing and constantly updating in order to make sure the information about both vaccine education and vaccine access is getting out there. All right, so next website is called vietfactcheck.org. This is also a bilingual website that provides articles specifically on COVID-19. It corrects misinformation that's out there. There's also infographics that we've created to show people what is the vaccine, how is it delivering information, things like that. So those are a couple of websites that we've developed for our communities. So next one, I think, Tong, you're going to talk about this.
Yeah, and this actually directly goes to Joe Long's point, which is that, in the midst of the COVID pandemic, we also are facing all this anti-Asian hate and racism. And one of the ways that our community has really dealt with this is the lack of language access, right? So, and what's happening is that we don't even know how much of a problem it is. We hear stories like Joe's story, but we don't know how much of a problem it is. And what we created now is this website called asianamvoices.org. And the goal here is for people to report problems that they encounter when they try to get the COVID vaccine because of language issues. And this is the way that we track this information. So for example, if Gwen wanted to go back to the Health Equity Task Force at the White House and said, hey, look what we're collecting this information, you need to take a look at this and see what we're doing. So we do want to collect that information. It's currently right now active. It's available in English, but by the end of the week or by the end of next week, we should have it in multiple Asian languages, including Vietnamese. And again, it doesn't necessarily help you get your family member a shot, but if you run into a problem and you were able to report it, at least you are going to help try to solve the problem in the long run for everyone. So we do encourage that.
Great, thank you. And we'll be going over just 2 minutes, if that's okay. And for our organizers, if we can unmute John Witten-Yap's line to share APCHO's resource. And John, you're unmuted.
Great, thank you. Thank you, Quinn. Thank you, Dr. Antu and Dr. Tung. Just really quickly, we have highlighted 2 resource hubs here. One is our general hub, which is definitely focused on healthcare workers, but there's information there for other people. What I would highlight is that there's vaccine information there and also multilingual resources to share with your community members, with your family members. And the other one is if you are in the Seattle, King County area, and or if you know people, we also have set up a specific one that has Vietnamese language. It's translated to Vietnamese, and there's a video up there, and there's some links that are local that would help them get tested, get vaccinated, information about how to get support regarding COVID-19 scams, getting support with language access regarding any insurance questions that might come up during the regarding the COVID pandemic. So I just wanted to share those, and thank you again for letting us be able to share this resource with you all, and of course hearing all of your great knowledge today. Thank you.
Thank you so much, John, and thanks so much, APCHO. And finally, we also want to make a quick plug for the Asian Pacific Islander Health Forum, who will be launching a new website on April 2nd called the Asian American Native Hawaiian Pacific Islander Health Response Page, with translated resources and events as well from community organizations. And we've included the website link here. And in closing, I just wanted to extend a thank you again to Bexy Enku and Bexy Tong for taking your time to share this important information as health experts, as role models, as leaders in our community. We want to thank our co-sponsors, and special thanks to our interpreters, Chị Trân and Chị Phương. And finally, to you all as our community members for coming today with your questions and trusting in us to be here. We hope that the information tonight has helped you become better informed as we work together to save lives by making sure that our loved ones get the vaccines they need and deserve. And I'm hopeful that my 6-month-old will be able to meet his own want, hopefully by the end of the year. So thank you all so much. Stay safe. We look forward to continuing learning and growing and building our community together. Have a great night, everyone. Thank you.
Thank you.